Welcome back. Well, for millions of young people, coronavirus restrictions have made access to school and tertiary institutions impossible, particularly with the lockdown in effect. Higher Education, Higher Health, a division of the Department of Higher Education and Training, is hosting a live broadcast titled Young People and COVID-19. Now, one of the speakers at this broadcast is Dr Ramneek Ahloowalia, the CEO of Higher Health at the Department of Higher Education and Training. Doctor, always a pleasure having you on the program. Thank you very much indeed for your time.
Good morning, sir, and such a pleasure too. Thank you.
Look, it's important, I guess, to get our youth back on track in terms of learning. Talk to us about this broadcast that you're going to be doing and the aim of it.
Not just the broadcast, but I'll try to explain the reason is we've got young students in higher education, in universities, in TVET colleges, and if we relate it to our education system, we also have young people in our schools. Young people are extremely equally susceptible to COVID-19. As much as global data shows that the severity of an infection of COVID-19 is very high among the elderly or among the people with immunocompromised or living with comorbid conditions. But young people are going to play a very significant role in this COVID-19 outbreak. They will be the carriers of this virus. You know, as a young person, to put you in a lockdown, you're confined into a home, you're fragile, you're young, you want to be going out. So at this moment, the aim will be is how do we bring responsibility among our young people? And all these broadcasts are aimed through our curriculum, through training them, capacity building them, trying to reach out to them through you and everyone else, is to try to engage them to say, at this moment, we need a very responsible youth. Because the youth can be a carrier of this virus and cause a major damage to our elderly and immunocompromised, as much as they will be equally susceptible to the infection.
I mean, to add to your point, the WHO was saying that a large proportion of people who are hospitalized around the world are under 50. And they were talking about Italy about 6-7 weeks ago, that they were saying between 10 to 15% of people that were in intensive care were under the age of 50. So talk to that point. Do you think that young people in South Africa are taking this disease seriously enough?
So I think the data is still coming in quite quickly, and you know, it's a novel virus. The virus is changing intensely, but you're totally right. The aim for us is to reach to young people. If they're not taking it seriously, they need to take it seriously for this country, for our country. To be very honest, young people, and they are vibrant, you know, they are young in reality. So they will be outgoing, they will be reaching out to many people. And this lockdown has helped us to curtail young people at their families or their home. But very soon or later, we need to keep on consciously having a dialogue with young people to ensure that this responsibility that the young people need to carry needs to be there with them. Otherwise, our system will start seeing more of young people coming into infection rate and susceptibility to the infection, which they are highly prone to.
You know, the data is still coming in with regards to the relationship between HIV as well as COVID-19. We know that young females in South Africa in particular make up a large amount of people who have been infected by HIV. Could, you know, once this data starts coming through, what do you have now that suggests that young women, young females, could be the face of COVID-19 in the future?
So the coronavirus, or novel coronavirus, is called novel because it's so new to human mankind that all of us do not have an immunity to this virus. As much as an HIV positive person, myself, yourself, each of us, young or old, we do not have an immunity to this virus. What does that mean is we all are equally susceptible to this virus. Now, when it comes to comorbid conditions, what we have known is if you're living with a disease like diabetes or hypertension or anything which is a chronic disease. Now, parallelly, if you are an HIV positive and you are not on ARVs, you're immunocompromised. Your body has more susceptibility to the coronavirus, like we all do anyways, in particular. So all what we're trying to say is anyone who's living with a comorbid condition, at this stage of what the global data says, we are more likely to have a severer infection compared to anyone which do not have an underlying comorbid conditions. So which means that young women with HIV, and if they're not on ARVs, it is very important for them for anyone to know their HIV status, to know their diabetes, to know their hypertension. Because at the end, if you are on treatment for any of these, you are able to control your comorbid disease so well that you then become, and you raise your immunity to so much that even COVID-19 will find it difficult to make you having a severe infection. But to get an infection, we all are equally prone to it.
The antibody test, Doc, which shows us who has had COVID-19 and has recovered from it. I guess it'll give us a sense of immunity in this regard. How fast or how important is it to fast track this test, especially here in South Africa?
So prevention is the only tool we have against COVID-19. Unfortunately, our mankind has not been able to break a treatment so far. And a treatment is still far, a treatment in form of cure or vaccine. So what we have is prevention, and testing is prevention. We've seen it with HIV. I think nothing better than South Africa to teach the world what it means to be living with chronic infections or infections like HIV and fighting a disease through testing, through a massive testing program. Probably we've got the biggest testing program in the world. And that was possible because we had a rapid test with us, which could take us the test into communities, do it door to door, do a rapid screening. At this moment with COVID-19, I think we are trying to crack the rapid tests. We have a lot in the market, but we are still relying on WHO, our own regulatory authorities to find whether this rapid test is equivalent or will give us the kind of results that our molecular test, which is the PCR that we are currently deploying. Should we crack this antibody test, which is rapid test, quickly, and should we go out, what it means is we can increase our testing program very intensively. We can use our community healthcare workers, our NGOs, we can bring it to schools, universities, and we can rapidly increase the rapid testing program. But so far, the rapid IgG bodies testing program has not shown the kind of effectiveness the way our molecular test immediately brings into reality of when the person gets into the infection. If our rapid test only finds out an infection later, this means the person has already infected others and the infection is still continuing. That defeats our purpose. So at this moment, science needs to be able to give us more possibilities of getting more testing into the communities. And I do think rapid test has the possibility, but it still needs to go through its proper mechanisms of effectiveness so that we can put into our algorithms, we can put into protocols, but definitely it can be a big game changer.
Testing. Never has there been such an important mantra, isn't it? I guess it gives us a clearer picture of what we're dealing with here so we can refine the strategy on how to tackle COVID-19. You comfortable, you satisfied with the rate of testing that's currently been done in South Africa?
I think the government is doing what it can and in this difficult circumstances. And I think the whole world, if you talk about the same debate in US or same debate in Italy or UK, I think South Africa is in a similar picture. Every day there's an increase. I think the government has taken a great initiative of deploying so many community healthcare workers to try to go to contact tracing. So I think the most important part is once we find a COVID-19, we need to do the contact tracing. And I think if we can go into communities and do contact tracing and isolate people very quickly by testing them positive or getting them to know their status, I think South Africa will do a brilliant job when it comes to prevention. We are not there yet, but we need to get there. And I think that's exactly where the whole emphasis is. Every day, this virus teaches us a new lesson. Yeah. Every day, a global data changes our protocols and makes us understand a guideline which is different from what we deployed last week. That's the nature of this virus and the newness of this virus. Yeah. So all I'm trying to emphasize is prevention is very key. If you have COVID-19 or you have got symptoms, isolate yourself very quickly. Test yourself and try to reach out to a test. And if you are proven positive, help the community healthcare worker to find your contacts, because we need to isolate them very quickly so that the spread doesn't happen more. Prevention is possible through testing, and that's why the testing program becomes very critical.
You know, there's this humility to this because it's so new and because we're learning every day about this novel coronavirus. And I hear you when you say prevention is better because there's so many unknowns that we're dealing with here. With regards to the scientific world, you know, focused, in sharp focus, with regards to this COVID-19, finding this vaccine, we're talking about 12 to 18 months away from getting this vaccine. A number of vaccines, well, drugs are on trial at the moment. Are you happy at the rate of the speed, or are you surprised by how far we've come in terms of understanding this? Because let's put it into context. 4 months ago, we didn't even know this existed.
I think if we go via science, the estimated time of getting a vaccine, the estimated time of getting a treatment, you might be surprised. South Africa is part of the solidarity trials and part of massive number of countries, probably 90 countries that are trying to do these trials on existing drugs. The best is to know what we know. So if what medications we know has supported a similar kind of viruses before or kind of infection that we're dealing with, let's try those clinical trials very quickly to see, can we crack a medication that will be effective to lower the infectivity of this virus? Vaccines, yes. Human trials do take the time. So if it follows science, the estimated times, what you said is correct. But I also believe in human brain that can work sometimes more quicker than we actually think in times. So yes, I think we should not underestimate that. Yes, science will take its course, but there might be quite an enormous. Remember, the whole world is trying to crack this, so we might be surprised. But what we have cracked at this moment is prevention. We know how this virus spreads. We know how long this virus stays on a surface. We know what it means to kill the virus on the surface. If we run a capacity building program, we run a proper prevention program, we use media to our effectiveness, we train, and for higher health, we are building an army of about 5,000 foot soldiers, which are in the form of our students, who can, at this moment, go out to meet out their peers and engage them what it means to be prevention, what it means prevention. How do you prevent a disease? How do you not let it spread? How do you clean? If we go with our guidelines to our institutions and say how we can clean and sanitize every evening before the students, when they eventually come to our classrooms, we have environmental cleaning purposes. So if we go with that route, we can still fight a disease to much bigger extent before we wait for a treatment or science to take its course when it comes to clinical trials. We do have something and we need to capitalize on it.
You know, I hear you when you say prevention is so important. Hope is also very important in terms of finding this vaccine in the near future. We know about some of these drugs that are coming to the fore being mentioned in public, hydroxychloroquine. We know about this drug called remdesivir, which was designed to fight Ebola. Do you see any light at the end of the tunnel? And the light that we want to see at the end of the tunnel here is sunlight, not headlights, if you follow what I'm saying. What's the caveat here? What's the warning here when we mention these drugs?
Very importantly, I'd like to convey to everybody who's listening is that we have to live with this virus till we crack a vaccine or some kind of intervention that can eliminate this virus out of human mankind, like we did with smallpox, we did with previous diseases like polio and etc. But on the other side, at this moment, let's not go with myths. Right. Let's not go with what social media speaks to itself. Let's believe in science. When we say that at this moment we do not have a treatment and we do not have a vaccine, that's a practical reality. All these medications have shown some kind of data of effectiveness. But have they shown cure for the disease? No. And for us to be able to give out, we need to do clinical trials properly. We need to see, remember, every medication has side effects. We might be giving you a medication, we do not even know whether it's curing a disease, but we might be leading you into more human problems or more organic problems because your human organs are having side effects to these diseases. So we need to let science play its way. We need to allow that these medication needs to be proven in terms of its efficiency and efficacy on human mankind. WHO, our human science trials, our own research councils in South Africa are doing their best to find a cure at this moment. Till we do not have, we need to refrain away from spreading false information. Some data do not suggest efficacy on human mankind. So from my side, we need to stay away from stigma. We need to stay away from myths. We need to stay away from false information. The reality is we got prevention. We got a testing program. We've got isolation. Till now, we have that as a confirmatory side of the story, and we need to live with that.
You and your colleagues are stepping up in terms of trying to educate the youth about this novel coronavirus. Do you think there's enough of this being done at this present stage? I mean, one would assume, or one would like to think, that this needs to be a daily occurrence, isn't it? There needs to be a sharp, focused approach, especially on social media, in order to bring in this information and dispel the myths that, has been going around, the fake news, as we call it.
So there's a lot happening. I think the world's technology has changed, and we're already into the fourth industrial revolution. So technology has a side effect, and technology has its advantageous issues. I think technology is playing both in this virus currently, and it's playing negative also tremendously. Fake news, rumors, they are killers in a very new virus like this. As any scientist or any doctor like myself will advise that we need to be very careful of what we absorb from social media or from media in general. We prefer news channels like yourself, sir. And it's not like just praising SABC. I'm trying to say authenticity is very critical. When I'm speaking today, we partnered with NICD, we partner with Department of Health as Department of Higher Education or Higher Health. We try to bring what is correct, what is important. Yeah. So be reliable on what information you get. What's the source of the information? Social media people are forwarding things on every day on different platforms. Be very careful what you're forwarding. You might be playing with a human life who is following that trail of information. So we really appeal that let's use technology to the right cause. Technology is brilliant. We can reach millions of South Africans in a blink of an eye through our radio channels, through you, through authentic channels. But authenticity of an information will decide the fate of this virus. This virus can go wrong if we have fake information moving at this stage. When you have very little known about this virus, when data is changing every day, when science is trying to crack this virus, authenticity of what we know at this moment, from where it rightly originates, is very sensitive. So I do appeal to people, to every viewer, young or old, please be careful. It's very critical and very sensitive at this stage.
Extremely instructive indeed, Doc. Tell us about the TikTok of today. What time are you guys starting? Where can people access this?
So we've got a young survivor of COVID-19 who's got the virus and has cured himself and come out of this virus. We've got somebody who's immunocompromised with other comorbid conditions. And we want to engage what it means to live with COVID-19, what it means to get COVID-19, what it means to be immunocompromised and knowing that you are more vulnerable to COVID-19 in terms of severity of the infection. So we start at 12 o'clock. We're live on Facebook on Higher Health SA, HIGHER SA. We're live on Twitter, similar, Higher Health SA. We're live on LinkedIn, Higher Health SA. And the aim is to stream 1 hour of using what youth loves, Facebook, Twitter, and their social media content. We'll be also putting these videos on YouTube eventually. We've done a series of webinars capacitating our academics, our researchers, our senior managers, our student support services, and now we're going to go and engage youth in the way youth loves. But we want to talk to youth with the youth. And youth, somebody who has gone through the COVID-19 and somebody who's immunocompromised and says, well, I am immunocompromised, what should I do? And how I am looking after myself. Yeah. So we want to tackle every angle of youth. Youth are very vulnerable. Youth are more vulnerable. They are equally susceptible to this infection. The fate of this country's virus, because we are a young country, our population is more in the median youth age compared to Italy or US. Yeah. Our youth will decide the fate of how fast we will spread the infection. Our president done a good job in locking us down. But one day our economy has to open. This youth will play a very significant role, and capacitating youth and reaching out to youth is very significant at this stage.
At this stage, this sort of broadcasts are so important, and we thank you as well as your colleagues for doing this and the work that you guys are doing. Please continue to keep in contact with us as well and tell us more about how you guys are trying to get this message out. We will try as much as we can to bring folks like you onto the program, onto the platform, various platforms that we have, to educate our youth as well as the larger society at large, to get a grip, get some purchase on the situation. Doctor, thank you very much for your time. Be well.
Such a pleasure, sir. Thank you.
All right, that was Dr. Ramneek Ahloowalia, the Higher Health CEO. So look, as you know, very, very important. We'll try to tap into that feed and get you that live broadcast at around 12 o'clock or so. I want to get you, paint you